When you take your blood pressure reading, you will notice that there are two numbers that are recorded. What do these numbers mean? The upper number is the systolic blood pressure reading. That is the pressure of the arteries when the heart pumps. The lower number is what is known as the diastolic blood pressure reading, is the measurement of the pressure in the blood vessels when the heart relaxes. In our Malaysian guidelines for hypertension, a normal blood pressure is defined as a reading of 120/80 millimeters of mercury or less. On the other hand, in our local guidelines, hypertension or high blood pressure is defined as a reading of 140/90 millimeters of mercury or more. The ideal blood pressure is basically 120/80 or below. Between 120 to 140 millimeters of mercury, which is the pre-hypertensive stage, your risk has gone up, but at that stage you may not necessarily need treatment because by definition this is pre-hypertension, means you have borderline hypertension. As I said earlier, hypertension is a major risk factor for cardiovascular disease. In fact, the higher the blood pressure is, higher is the risk of a cardiovascular event. Patients with hypertension are 3 times more likely to die from a heart attack and 4 times as likely to die from a stroke compared to normal population. In fact, the higher your blood pressure, the higher is that risk of having a heart attack or stroke. By the same token, if you reduce your blood pressure, then there will be a concomitant reduction in your cardiovascular risk. Meaning, if you can reduce your systolic blood pressure by more than 20 millimeters of mercury, you will have a concomitant reduction of more than 10% in terms of your cardiovascular mortality. It means your risk of dying from a heart attack goes down by 10%. Likewise, if you reduce your diastolic blood pressure by more than 10 millimeters of mercury, there is also a further 10% reduction in your cardiovascular mortality. So it is important to monitor your blood pressure, important to actually get your blood pressure down, and the lower your blood pressure is, lowers your cardiovascular risk. For many people, there may be elevations in both the systolic and diastolic blood pressure. That's perhaps the most common form of hypertension. Both the systolic is above 140 and the diastolic is above 90 millimeters of mercury. But there is a subgroup of patients, or there are some patients who actually have only what we call isolated systolic hypertension, particularly in the elderly. As I said, when the arteries are stiffened up, they have an increase in the systolic blood pressure, but their diastolic blood pressure is normal. This is known as isolated systolic hypertension. Thank you for watching. I hope you liked the video. If you do, please don't forget to like, share, and comment.